Hi guys, Dr. Qureshi here, and I saw an interesting case in the clinic today, so I decided to make a video as I left the clinic. So it's called central serous chorioretinopathy, also known as central serous retinopathy, or commonly in doctors' terms we call it a CSR. And normally I see it in men more so. So a lot of times there will be guys in their 40s or maybe even late 30s or late 40s would come, early to late 40s, and they would be all type A personalities. It's very interesting how it almost always happens in guys, and they have high stress in their lives. They are typical type A personalities, like high achievers, and they are just like very much ambitious and motivated in life, which is a good thing, but sometimes they can end up having a central serous chorioretinopathy or central serous retinopathy. So I decided to talk about it briefly with you guys so that you are aware of what are the symptoms and what are some of the things to remember and to keep in the back of your mind if you ever experience this condition. So as the name indicates, is central serous. So that means it's in the central part of the retina. There is an area which is known as choroid, which is right below the retina. The retina has 9 layers, as I have mentioned in several of my videos, and right below that is the choroid. So it's in the central part of the retina that there is fluid accumulation, and the patient starts having disturbances in the vision. So his vision can start getting blurry, distorted. A lot of times they talk about waviness, things are crooked or blurred, basically. It's not a permanent thing. Most of the times I see it's a temporary thing. In a lot of guys, it goes away on its own, but in some patients, I have had to send them to a retina specialist so that they can get treated for that. The treatment involves laser therapy or laser treatment, and I would leave that to the retina specialist to do that for my patients, and their vision does come back to normal in a lot of instances. I have seen their vision come back to being normal, and I just keep monitoring them. Some of the tests that I do for these patients is the OCT of the macula that shows me a typical fluid accumulation in the right below the retina, and right below the retina is the choroid area, and so I see that accumulation of the fluid right in between those areas, below the retina and above the choroid area. So now, what are the causes for the CSR or central serous chorioretinopathy or central serous retinopathy? Stress is number one in the list, and that's what I noticed that in my patients. So I recommend decreasing their stress levels with meditation, prayers, seeking counseling, going to a psychologist, psychiatrist, or even if they need medication to decrease their stress levels. So number one is stress. Easier said than done, but that's something that I have to recommend to my patients to control or decrease their stress levels. The second thing, I'm just going to list all the causes, even if they're rare causes. I just decided to just mention it to you guys. Hypertension can also lead to CSR if it's uncontrolled, obviously, and then pregnancy, so it can happen in women sometimes, so pregnancy can also cause CSR. There are certain medications that can be linked to having CSR, such as stimulants, congestants such as nasal sprays can cause that. In men, erectile dysfunction medications can cause it also. Chemotherapy can be associated or linked with CSR also, according to literature. Then there are some rare causes that I still wanted to mention in the video. Autoimmune diseases can cause it. Certain autoimmune diseases like lupus is one of them that I was reading about. And so stress, pregnancy, hypertension, and then medications, they can all be linked to CSR. And just remember that if you control your stress level, a lot of times I've noticed the symptoms go away. It normally happens in one eye, so it's unilateral, and it's mostly temporary visual disturbances, so it's not like a permanent thing. After the laser treatment, it does get back to normal. So read about central serous chorioretinopathy and check out where in the retina it gets affected, to the point where your vision starts getting blurry because of fluid accumulation. But the outcome is really good after the retina doctor does the treatment in the form of laser treatment. So that's CSR. You guys have a great day. Bye.